The measles outbreak that started at a California theme park last year is over. State officials said today that the last new case was reported 6 weeks ago. But with several pockets of unvaccinated residents and many parents opposed to immunization, officials say it could happen all over again. Robert Ray reports.
John, health officials say that Disneyland was the perfect place for a measles outbreak to start. Now the state and CDC is looking at practices and how to make sure this doesn't happen again.
According to officials at the California Department of Public Health, the measles outbreak that began at Disneyland is officially over.
A final total of 131 Californians infected with measles were identified as part of this outbreak. Patients range in age from 6 weeks to 70 years. Vaccination status was available in only 62% of the cases. Among them, 70% were unvaccinated.
The declaration is based on no new infections having been reported in 42 days. That's 2 incubation periods. The outbreak started in December when 42 people were exposed to measles at Disneyland, and they spread the virus across 6 states, Canada, and Mexico.
Here at the Centers for Disease Control and Prevention in Atlanta, scientists worked closely with health officials in the state of California. They even sent out a team to do contact tracing. What that means is they set up a perimeter in California and tried to figure out exactly who the people were that had the measles infection.
What happens globally is
Dr. Greg Wallace leads the measles team at the CDC and says since the outbreak, they are stepping up communication about the virus nationwide.
So just increasing the awareness, not even so much the health departments, but clinicians who are seeing lots of rash illnesses in their practice, to make sure that they ask about travel history, vaccine history, and keep measles on their mind as a possible reason for their illness.
While the Disneyland outbreak is over, there are still other measles cases around the U.S. So far in 2015, 159 cases in 18 states have been reported. In comparison to 2014, the numbers, they're low, 668 cases in 27 states last year. That is the most this century.
If you think about it on a global scale, we're a very small problem. I mean, even with our larger outbreaks recently, on a global scale, these are very small outbreaks. So the global effort is really the focus.
Measles is still common in many parts of the world, and doctors say most who contract the virus in the United States are not vaccinated.
Small outbreaks here, but a plane ride away to here, which could create havoc in a system where people are not immunized.
The biggest problem is getting rid of the sources globally, and that's a bigger problem.
Now that the outbreak is over, legislative efforts continue in several states, including California, to stop the so-called anti-vaxxers' influence on outbreaks of infectious disease.
Has Disneyland or Disney World come to you guys and said, you know, what can we do so this doesn't happen again?
Well, I think those conversations are actually happening at the state level. So we would just encourage what we say for any place that would have lots of workers, lots of possible exposure to foreign travelers, is that everybody be up to date on their vaccine.
Now, disease detectives say that they may never find out who patient 0 is or exactly how the measles outbreak began, but they do say that it's likely that it was brought in from another country.